Hello, my name is Abby Rockers. Today is February 15th, 2018, and today I will be performing how to do trach suctioning and trach care. So I would first start off by walking into the room. I would introduce myself. Hi, my name's Abby. I'm going to be your nurse today. We're going to be doing some trach care and suctioning. Do you have any questions about that? Okay, so I provide for privacy. I would perform hand hygiene. And before I would start anything, I would want to hyperoxygenate my patient to make sure he was getting enough oxygen before we would do all of the care. I would also assess lung sounds. I would assess the respirations for the rate, rhythm, depth, and just the lung sounds in general. I would also want to assess his pulse rate to make sure it wasn't too high or anything like that before we would get started. So like I said, I would provide privacy. After he was hyperoxygenated, I would go ahead and I would take his oxygen mask off here. And then I would lay this towel down just in case any kind of drainage would come out. All right. Sir, before we get started, I just wanted to let you know the suctioning, it might cause a little bit of discomfort if at any point it gets too painful or too much for you or too uncomfortable. If you could just give me a thumbs up or thumbs down on your left hand there, okay? Can you do that for me? All right, so I would want to communicate that out first in case, obviously, if they couldn't speak, they could let me know if anything is getting too uncomfortable for them. So once I started that, I would make sure my suction was between 80 and 120, and then I would go ahead and I would don my sterile gloves. I would open actually my catheter kit here first, opening it away. All right, and then I would get my sterile water set up, touching only the top of the lid here. So it'll be ready to go. Okay. So I'm going to don my sterile gloves. All right, touching only the inside here, keeping it above my waist, drop it into the trash can. Okay, so next, what I'm going to do is take my suctioning catheter out here, kind of coil it up so it's not hanging everywhere. And what I'm going to do here is take the suctioning tube here. Once I touch this hand is non-sterile, my non-dominant hand here, so that will not touch the catheter tip any longer. I'm going to go ahead and lubricate the tip of the catheter. Okay, so we're going to go ahead here. Let me know, again, if you raise that hand if it gets too uncomfortable, okay? I would place it in until I met resistance. All right, I'm meeting resistance. So now I'm going to intermittent suction out while twisting, twisting. All right. So now that I did that, I'm going to go ahead, take his dressing off here, disconnect the suctioning. I'm going to go ahead and coil it up, take off my sterile gloves, throw this away. I'll also throw this away just to clean off the area. And I would put this away because I do not need it anymore. Okay, so next what I'm going to do is we're going to clean out the cannula here. And so first I'm just going to set up my sterile field and perform hand hygiene again. Open the kit out. I'm going to open this up, touching only the outer inch of the sterile drape. All right. So then I'm going to go ahead once I've done that. Raise the bed up so I'm not bending over. Okay. I'm going to go ahead and take out my sterile gloves. Go ahead and throw that away. So now I have my sterile gloves and I can touch everything and finish setting up my sterile field. I'm going to take out my Trache collar. This will be the sterile gauze that I put around it after it's cleaned. I'm going to go ahead and set these up here. These are my gauze, sterile water, hydrogen peroxide solution, and my cleaning supply. So I'm going to just place my gauze in here so they can be moist for when I need to clean them. I'm going to go ahead and open up my sterile water packet here. I'm going to pour a third in the first compartment, a third in the second compartment, and the rest over the gauze. I'll throw that away. I'm going to go ahead and open up my hydrogen peroxide mixture, and this first compartment here is going to be a 50% hydrogen peroxide, 50% normal sterile saline in this compartment. So that's done. All right, so then I'm going to take with my non-dominant hand, take out the cannula. All right, now that it's out, I'm just going to drop it in this 50-50 solution here of the hydrogen peroxide and normal saline. Let it kind of soak up there for a second. And then what I'm going to do is I'm going to get my little cleaning plunger here. And again, only touching it with the non-dominant hand. I'm going to clean out this cannula. And once it's good and clean, how I'd like, I'll throw it away and drop it in the sterile saline mixture to clean off. All right, and then once that's cleaned off well enough, I'm going to go ahead and insert the clean cannula back in, wait until I hear that click, and then I will know it's secure in there. All right, so after that, I'm going to go ahead and I'm going to get the gauze and hold it only with my sterile hand. I'm going to clean around the cannula, one swipe, throw it away, clean around that cannula and just the trach site with one swipe again, throw that away, and one more time, one swipe, throw that away. All right, so then after I was finished with that, I would go ahead and throw all of my cleaning supplies away here. And then I would re-don some new sterile gloves, but since I've already done it twice, I'm just going to keep these ones on. And we're going to trade out the Trache collar here. So you keep the old Trache collar on first, just to make sure it's secure while you're changing it out. All right. So like I said, I'm just going to thread this through, making sure it's nice and secure. And I'm going to just lift the head up, go behind my patient's head. Okay. I'm going to reattach on this side. There we go, got it through the catheter. Make sure it's fastened well, and then I'm going to go ahead and detach the old one. So I don't need that one anymore. catheter secure. I'm going to go ahead and throw that away. I'm going to go ahead and reapply a new sterile dressing. So it's going to go under the cannula there, under the collar. Just make sure it's nice and secure. I'm going to go ahead and use this to finish placing it how I want it. All right, good. I'm going to go ahead and take this off now. I'm going to note, document any kind of pertinent data, the color and consistency of the secretions that came out, how the patient tolerated the procedure, and any other pertinent data, like I said. I would go ahead and place the oxygen mask back on my patient. I would turn it down to the normal oxygen level that he was at before we hyperoxygenated him. So make sure he's breathing well. I would reassess his respirations to make sure he was doing well again, and go ahead and place him down with the bed in the low level. Alright. I would go ahead and clean up and, like I said, document everything, and then I would be finished with this procedure. Thank you.